Hi, my name is LaNia Taylor and I am a Tuskegee University senior nursing student, and today I am going to be performing my checkoffs on intradermal, sub-Q, IM, and also how to start and to discontinue an IV. So today I'm going to be performing my checkoffs on the same one patient. I'm going to go in and do all of my injections all at once. Before going to my patient's room, I just want to check my MAR, make sure I am giving the right medication. At this point, I would then go over my 6 rights, just make sure I'm giving the medication to the right person, make sure I'm giving the right medication, make sure I'm giving the right dose, make sure I'm giving the right route, make sure I'm giving it at the right time. And then after, I need to also make sure I'm doing the correct documentation. And also, our patient has that right to refuse. So I guess it is 7 nights instead of 6. So just make sure we always remember that they have the right to refuse. So I check my MAR. I made sure that I've had the right patient, that I'm giving the right medications. I've checked all the expiration dates on all my medications before I drew them up. So all of them are within the expiration date that they are needed to do. So now that I've gotten all my stuff together, I've gotten everything that I know I will need for all of these injections. I will make sure I get it all together, bring it to the room with me. So now that I'm at that point of going into the room, I will make sure to knock. And then when I come in, introduce myself. My name is LaNia Taylor. I'm going to be a Tuskegee University student nurse today, and I'm going to be giving out your injections. Can I get your name and date of birth? So then they're going to give me their 2 patient identifiers. Ooh, excuse me. And then I'm going to go ahead and prepare all of my stuff personally. So then when they give me those 2 identifiers, it's also another time for me to check and make sure I have this right patient, the right medication, and the rest of those rights that they have for medication administration. So now that I've went through and I've checked it once more, I'm going to go ahead and perform my hand hygiene. Okay, I perform my hand hygiene, and first today we're going to be doing the intradermal intradermal injection, which today for that intradermal injection we're going to be doing a PPE, which is just a TB test. And so before doing that, I just want to ask my patients some quick questions. Ask them if they've ever had a TB test, have they ever had a positive reading, if they had any bad experiences, any reactions. I just want to know before I do perform this injection. So I would have done this in the medication room, but like I said, I want to check the expiration date for my medication. Also check the expiration date for the syringe that I've used. And we're using a TB syringe, so we know that it is within range and it's within expiration date. So this one's okay. So now that I have all of that, I'm going to go ahead and ask my patient which arm they would like me to use for their TB test today. And then whenever I give that TB test, I want to make sure that it is in the forearm area so that we can properly give it. So now that I have my hand hygiene done, I have my gloves on, so I'm going to go ahead and find that spot on my patient, and I have found that spot. Let's move this down so that you're able to see. So today this is going to be my patient. So I found that spot that I want to give that injection in. So I'm going to first start with cleaning that area, and I'm just going to go inner to outer. That went over the same space twice. So now I have my needle here with me on some gauze. So I've already had it pre-filled, so now I'm just going to go ahead and take the top off. And I want to make sure my bevel is up so that I know I'm inserting it. So here with this, we're going to keep it at a 5 to 15 degree angle because we do want to just be right under that skin surface. So I'm going to taunt the skin just to make sure it's straight. And then I'm just going to come in at a low level, more of a straight level, and just get right under the dermis. And now I'm under, and I can see my needle a little bit through there, So then I'm going to just go ahead and slowly insert, and it's going to create a little bleb. So then I'm just going to take it out, make sure to intact my stapling mechanism. And now I'm just going to take a gauze and just wipe over it lightly because we don't want to mess with the bleb that we have set there. And also when we are done with our TB, we need to make sure that we document, which is at last 6, right? Make sure we document where we've put it, the day we've put it, if there was any reactions that they had to it. We also want to put that. And also when we want to teach them when they need to come back to have it read. So with the TB skin test, we usually need to come back in 3 days and have it read. So we need to make sure we notify them of that and make sure they don't touch it, itch it, because that can create irritation and create a false reading with the TB. So we just want to make sure that we do all of that with our intradermal injection. So now that we have finished that with our intradermal and our patient has gotten that, we will now be moving on to our sub-Q injection. And today this patient is going to be just getting their insulin, and we are just going to be giving them 20 units of insulin today. So we have that ready. And like before, like I said, in the medication room, I would make sure that my insulin was up to date and it wasn't expired. Same thing with my needle. This is an insulin needle, so it is already prepped for the gauges and sizes that we need for the needle, but I make sure that this expiration date is within range also. And so now that I've done that, I'm already in my patient's room, so I've already got my 2 patient identifiers. One thing I do want to ask my patient when giving their sub-Q, I want to make sure to ask them where they got their last injection, because I do not want to give it in the same spot. We don't want to constantly give them injections in the same spot because that can create breakdown and irritation. So I just want to make sure. For this patient, she told me she got it in the back of her arm fat last time. So today we're going to do it in her abdomen. So like I said, I have my needle, I have my gauze, and I have my alcohol prep. So now I'm going to go ahead and perform my hand hygiene. And put on my gloves. Okay, so now that I've got my gloves on, I created privacy for my patient because we are doing it in the abdomen, which means I do have to move their gown around. So I want to make sure that they have that privacy. And after that, we will go ahead with our injection. So here I'm going to, just like always, I'm going to clean my site. So I'm going to go inner to outer with it and discard that. So I have my needle with the fluid. So since we are doing a sub-Q injection, usually with this, we do it to a 45 to 90 degree angle. Which angle you use depends on the patient and how much fat they have. So today my patient has adequate fat in this area, so we're going to go at a 90 degree angle to give this injection. So with the sub-Q, we want to make sure that we're pinching that skin so that we're right there in that sub-Q. So now I'm just going to go ahead with my injection. Insert. Let the patient know that I'm injecting them, and once I'm done, I'm just going to go ahead, apply some pressure, initiate my safety mechanism. Okay, then after that, I would just make sure to wipe, make sure there's no irritation, and that the patient is okay. And also with this one, like our last 6, right, we need to document. I need to make sure I document where I gave that injection, what I gave, and how much I did give, so that the next person knows where to give and to not give the injection for the patient next time. So now that I have done that, we are done with our sub-Q injection. And next we're going to go into my IM injection. So for IM injections, I'm going to make sure that my patient I'm going to ask if my patient has had an IM injection before, and if they have, the last time that they got it. And I just want to look at that site and to observe, make sure there's no irritation or anything in that area from the last time they got their injection. And then also with the IM, just like sub-Q, we want to make sure that we're rotating the sites. So for this, I would ask my patient the last time where they got it. So last time I got it in their left deltoid. So today we're going to give it in their right deltoid. And then also with IM, we have three different sites that you can use, which is the deltoid. You can use the vastus lateralis, or you can also use the ventrogluteal. Today we're going to be doing the deltoid. And in the deltoid, we can do up to 1 milliliter. And today we're just giving 1 milliliter of their medication. So we're going to be giving it in the deltoid. Just like everything else, I want to have my alcohol pad and I want to have some gauze with me before doing the medication. So I'm already in the patient's room. I've got those two identifiers. I've asked them about their past injection, make sure everything was okay and there's no reactions to the medication. So now that I've got that, I'm just going to get my hand hygiene together. So I'm going to perform my hand hygiene, grab some gloves. And then also before giving this medication, I want to check my MAR, just make sure I have those 6 rights. Even though I did it earlier, I just want to check one more time before giving that medication. So now that I've found that deltoid, so to find a place to give the injection for the deltoid, you're going to find the acromion process, which is this part just right over your shoulder. So I would find the acromion process and then give my V, and I would just give it right in the middle of that. So I found that spot on my patient, and now I know where to go. So now we're going to just clean that site from inner to outer. Okay. And once I've got that, I will discard that part. Okay, so now I have my needle and I have my gauze. And for this, I'm going to go ahead and just take this off. And then for today, with this syringe and the needle, it's a 3 milliliter syringe with a 23 gauge and 1 inch, which those are within range for what we want to use for our needle size and gauge for our IMs. So with the IM, we do go at a 90-degree angle. And also today we're going to be doing a different method of insertion for our IM. We're going to do a Z-track. And so with the Z-track, I'm going to make sure that I'm taunting and pushing that layer of skin out of the way. So I would move this over so that it can get me closer to that muscle. But since I have such a small space, I can't Z-track and have enough room to do the needle. But in a normal Z-track, I would move to the side and then go ahead and insert over here because I'm moving that fat out the way. So we're going to pretend like I'm Z-tracking right now, moving that skin out, and then I would go in at a 90-degree angle, and then I would just go ahead and slowly but quickly insert it. And now that I have it inserted, I would take my gauze and just apply a little pressure. It might bleed a little bit, so I want to engage that safety mechanism on my needle also. I would just hold this for a little while, make sure there's no pain. It might create a little pain because we are in a muscle, but just make sure it's not really bad pain. So now that that's done, I also want to make sure that I document, just like everything else, make sure I document where, how much I gave, where I gave it, medication I gave, and how much I gave of it. So we always just want to make sure we're checking and documenting that. So now that we've done our IM, lastly, we're going to be starting and DCing an IV. So with the IV, we can use it for many different things. Most of the time, an IV is used if someone needs fluids, like for giving someone fluids, or if we are patients having a blood transfusion, they can get fluids, or if they're going into surgery, we will also use an IV because sometimes sedation or medication can be given to that IV while they're in surgery. So we always want to make sure we have a patent IV when we go to surgery. So today for our IV, we're going to be using the IV starter kit, which has everything in it that I will need for my checkoff. And then also we're going to be using catheter. Catheter today is the 22 gauge and it's the 1 inch. So today our patient is just going to be getting some fluids because they're a little dehydrated. I'm already in the patient's room. I've got those two patient identifiers. So now I just want to ask my patient, do they have any allergies? Because we are going to be using adhesive tape, so we just want to make sure that they're not allergic. And just also ask them if they had any problems with their last IV, because that might help us in the present time with giving this IV. So we always just want to ask that. Did they have any complications with it? Any irritation, swelling, stuff of that nature? So this patient said, the last time I had the IV, it was a great experience. So that is great. So now I'm in my patient's room. I'm going to perform some hand hygiene, make sure my hands are clean, and I'm going to ask them, do they have a preference of which arm they would like their IV in? My patient today said she wanted it in her left arm, so we're going to give it in the left arm. And with this, I'm going to have her put her arm in the dependent position, just paying it down low so I can have the blood rush. And so while she's doing that, I'm going to then take an alcohol swab and have that sitting, have my alcohol swab sitting. And then I'm going to, in my little IV kit, we got a little small tourniquet. So I'm going to go ahead and take my tourniquet and I'm going to put it on my patient, but I don't have an arm today, so we're just going to put it on here as if I am applying the tourniquet on the arm. So we have our tourniquet there. So now that we have the tourniquet on the arm and it's in the dependent position, I'm going to be able to see a little bit. And then even if I can't find a vein, I can just take an alcohol swab, just wipe it, and it'll kind of bring up some of it. So now that I've done that, I'm able to find that vein that I want to use. I see it coming up. So now at this point in time, since I found that, the alcohol would be dry by now. And so since I found that, I would take my chlorhexidine. I would go ahead and break it. So now that that's broke, I'm just going to go on an inner to outer motion with it. Okay. And now that we've got that clean, I'm going to discard that. And so then at that point, I'm going to have to let it air dry. So I'm going to take off my tourniquet, let my patient breathe a little bit. I'm going to be talking to them. And while that is breathing, I'm going to then get my stuff together. I'm going to be doing the tape. I'm going to take some tape out so that I'm able to secure my IV when I have it inserted. Okay. And just have those ready. Then I want to have my Tegaderm over here out and ready. I do have my saline syringe over here ready and prepped so that when I insert, I'm able to connect it onto there. I have some gauze just in case. And then make sure we want to open up the catheter. So, and just have that over here and ready. So, as you can see, it's dry now. So, I'm going to reapply my tourniquet. So, now that I've got that tourniquet on and my surface is clean, I'm going to then put on my gloves. Okay, and now my gloves are on. So before doing this, also one more time, want to check my MAR, make sure I have everything. And so now that I know and made sure that I have the right patient and those 7 rights, I'm going to go ahead and take the top off my catheter for my IV. Make sure my bevel is up. We do want the bevel to be up when we're doing this. So now I would just want to be able to taunt the skin. I don't want to taunt it up because I don't want to accidentally hurt myself. So we're going to taunt it down. And we're just going to go in at a slight angle. Okay, and now we're in. So I've got a little bit of flashback, so I'm going to just level out and start to advance the catheter. And so now that it's advanced, I'm just going to go ahead and take the needle out and make sure to occlude in that area. So now that I've done that, I'm going to go ahead and put my catheter, make sure to pull it out. So now that I have this here, I'm going to go ahead and connect my saline onto it. And make sure not to touch the insertion site. And then after, I'm just going to make sure to secure my port right here, still not touching the actual site where it was injected, which is good. So now that we've got that secure, I would then take my Tegaderm and then we're just going to do this to secure that IV. And at this point in time, I wouldn't have the saline lock after I flushed it. I would then connect my fluids, but since we don't have any fluids right now, we're just going to initiate that IV. And also when I'm flushing, I need to make sure to ask that patient if they are feeling any burning, any coolness, just what type of sensation they're feeling. We don't want it to be a burning feeling. We want it to be a cool sensation. So after I perform my IV, I just want to make sure and check in on my patient, make sure there's no redness, itching, swelling, and most of all that burningness when I flush. We just want to make sure that none of that is happening, and just like also document that last right. That we need to do is just to document where we put that IV, what size needle, what size gauge it was, everything, so that we know when we take it out what we need to be looking for. So lastly, now we're going to DC the same IV. When we DC, we're going to go ahead, come in the patient's room, ask for those 2 patient identifiers, and then we're going to tell our patient what we're doing. Just like with everything, we're going to tell them what we're doing, whether we're discontinuing their IV. For what? We don't know. They could be going home. They could not need it anymore. Whatever the case may be, we just want to make sure we're letting them know. And when I'm discontinuing IV, you really only need a couple of things. You just need your alcohol swab, and you need some gauze and some tape. So today we're working on the same IV, so I've got my alcohol swab, and so with this, I'm just going to go ahead and around the skin, and it'll kind of loosen up that tape a little bit, kind of be gentle, but at the same time be, rough enough to get it off. And then when we are DCing an IV, we always want to pull like down, because we don't want to forcefully pull that IV out. We want to when we're pulling that tape off, we don't want to accidentally like rip it out. So we just want to make sure that we're pulling down to where the IV won't come out. So now I'm taking off the Tegaderm just so it won't hurt so much. And as I'm taking it down, I'm still going downward so that I don't pull that IV out roughly. Okay, and our catheter is still there, intact. And we're just gonna continue to pull this one off. Just be gentle, especially if they have hair. We want to be a little gentle. So I've got the Tegaderm off. So now that I've got that off, I'm then going to take some more alcohol to just get that tape off that's around the hub. That's just keeping it steady. So now I've got that. So now lastly, what I would do is just take my gauze on top of that and pull my catheter out. So for here, we could just see that the catheter, it's a little bent, but it is still intact. There's no missing pieces. And now that we've DC'd that, we are all good. And that is my checkoffs for the day. My name is LaNia Taylor, and I am a senior Tuskegee University nursing student. Thank you.